Good afternoon, everyone. Joining me to my right is the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persichilli. To her right, the Department of Health's COVID-19 medical advisor and former state epidemiologist, Dr. Eddie Bresnitz. To my far left, another guy who needs no introduction, State Police Superintendent Colonel Pat Callahan. And I'm thrilled to welcome back to my immediate left, Acting Commissioner of the Department of Education, Dr. Angelica Mcmillan. A special note today, with a heavy heart, that this will be Eddie's last time with us at this table, assuming this damn thing doesn't come back and rear its head again, as he prepares to move back to private life at the end of the week. Who could blame him? But Eddie, I would be remiss if I did not, on behalf of all of us, thank you publicly for your tremendous guidance over the past year plus as we have tackled this unprecedented public health challenge. We are in the place we are today and prepared to take the steps we'll take on this Friday and next Friday, in no small part because of your hard work. And on behalf of all of us, I say thank you. And by the way, don't change your cell phone number, just in case. I know Judy joins me in that as well. Eddie, thank you for everything. I've also asked Angelica to join us because on Monday the department released its plan for the investment of more than $2.75 billion in federal elementary and secondary school emergency relief, otherwise known by many as ESSER, funds made available to us through the American Rescue Plan. This includes the department's district-by-district funding of nearly $2.5 billion of these latest federal relief funds, 2/3 of which was released in Monday's allocations. There is no doubt that over the past year, the past year has taken a tremendous toll on our educational communities, not just on students, educators, and school leaders, but also on their families. Through this partnership with the federal government, we're going to work to ensure that every district has the resources it needs to fully get back to where it should be. This includes making sure that every school reopens for all in-person instruction for the 2021-2022 academic year. We know our students learn best and that our educators and support staff are at their best when they are in their familiar classroom settings. We know that there are students whose learning over the past year has been directly impacted, and part of our investment will be to ensure that they get back to where they belong in their educational journeys. There is so much that was lost during this past year of largely remote learning, but that personal connection, the connections between educators and students and their peers, and among educators, is what was missed the most because it is the most impactful to the success of our schools. As we sit here today, districts serving more than 95% of our students are now open for in-person instruction for at least part-time. 400 districts are back for full in-person instruction, while 363 are open on a hybrid schedule. Just 8 remain all remote. The progress we've made in getting our kids back to school has been enormous. And by the way, that 8 includes single schools, not just a multi-school district. Now is our time to build upon this momentum to ensure that the 2021-22 school year sees all of our students succeed. And through the work of Angelica and her team at the Department of Education and alongside educators, families, and stakeholders, I know they will do just that. So again, in a few minutes, if it's okay with you, Angelica, I'll ask the Acting Commissioner to lead us through those efforts again in just a few minutes. Next up today, I will be issuing an executive order giving additional guidance and flexibility to employers, and especially those in office settings, as they look to their own continued return to normal operating practices. This order will be effective next Friday, June 4th. As we have done, we want to give our businesses ample time to make the right decisions for their employees and workplaces. First, while all workplace health and safety protocols apply to indoor work sites closed to the public, employers will be able to allow employees who can verify that they are vaccinated the ability to forego wearing a mask and social distancing. We've heard this from a number of different businesses, including and especially those that operate in multiple state and multiple jurisdictions. By the way, there should never be any stigma against any coworker who may be fully vaccinated but chooses just to be safe to wear a mask. That's still okay anywhere, anytime, as a patron or as a coworker. And at this time, we are going to continue requiring state employees to mask up and to keep social distancing at state offices and work sites while we continue to transition back to normal. Second, I am rescinding the portion of Executive Order number 107 that requires businesses or nonprofits to accommodate remote working arrangements and to reduce their on-site staffs to the minimal number necessary. We're doing this to allow employers greater flexibility to bring employees back into in-person working environments. We encourage all employers to do the right things for their specific workplaces. While we are rescinding some requirements, that doesn't mean that we don't expect you to be flexible and to work with employees, particularly those who are juggling family obligations, such as childcare. And on the topic of childcare, through the Departments of Health, under Judy's leadership, and Children and Families, under Christine Norbert Byer's leadership, the group limits in child care classes, which are currently capped at 15, will be returned to their normal regulated limits, effective immediately. We know how critical access to child care is for many working families, especially for working moms, and restoring these limits to their pre-pandemic standard is an important piece of getting our economy back working for more parents, as well as for peace of mind. And before we get to the numbers, switching gears, a reminder from the New Jersey Economic Development Authority that Friday is the last day for small businesses to apply for discounts of up to 70% on any PPE they need for their businesses. Even with the broad lifting of our indoor mask mandate occurring on Friday, as we noted, there are businesses where the requirement that workers continue to mask up will continue, such as in childcare, medical offices, and warehouse and manufacturing. So this is this is a last opportunity for those employers to stock up on masks or other PPE for their employees. Since its inception, the EDA's Small and Micro Business PPE Access Program has helped nearly 13,000 small employers save a total of more than $11 million. For more information or to apply today to take advantage of these last 3 days of the program, go to that website, ppe.covid19.nj.gov, and join in. And I extend again my appreciation to the Chief Executive Officer of the Economic Development Authority, Tim Sullivan, and his team and board for all they have done over the past months to make this program a success. And while we're talking about the EDA, one of the runaway successes they've had is their Sustain and Serve NJ program, which has partnered organizations fighting food insecurity in their communities with local restaurants. Sustain and Serve has been the ultimate win-win. Key organizations have received millions of dollars in vital supports for their missions at a time when demand for their services has been overwhelming, and at the same time, local restaurants have been kept strong by the orders for fresh cooked meals. Let's head up to Morris County. The Morristown Rotary Club received a $240,000 grant through Sustain and Serve. With this funding, the Rotary acted as a catalyst for the area, bringing together the nonprofits Homeless Solutions, Nourish NJ, and Table of Hope, along with the Morristown and Morris Township housing authorities, as well as the Morristown and Morris Township police and fire departments, to provide nearly 24,000 meals to families across their area. Rotary board member and past president Nick Walsh was the man behind this effort, and I had the chance to thank him and current president Ray Wenzel, and those are the two gentlemen right there, Nick and Ray, for the Rotary's great work and history of community service. The Morristown Rotary will be celebrating its centennial next spring, and they are already setting the bar high for the next 100 years. We thank Ray and Nick and everyone for their support. Check them out, by the way, morristownrotary.org, morristownrotary.org. It's an outstanding organization. Next up, let's take a look at today's numbers. First, we are reporting a total of 4,134,624 fully vaccinated individuals. Of these, roughly, as you can see, 3.967 million have been vaccinated at one of our in-state sites, while an additional 167,000 were vaccinated out of state. The total number of individuals who have now received a first dose at one of our in-state vaccination sites is now at 4,831,346. And if we broaden out to look at the numbers compiled by the CDC, their count has more than 5.2 million New Jerseyans ages 12 and over having now received at least one dose. That's 68.5% of all residents, in this case 12 and up, and that ranks us number 7 in the nation and number 1 or 2 consistently among the big American states. Now, just to reaffirm a few points for those who are not yet vaccinated. We know there are many reasons why some folks have yet to start on their journey to vaccination, including some potential misunderstandings. And Judy, I wanted to address a couple of those, if it's okay. First, there are lots of places you can go. There are more than 1,700 places across our state where you can be vaccinated, ranging from our 6 mega sites to more than 700 pharmacies. There is a vaccination site near you. You can use our vaccine finder at that website, covid19.nj.gov/finder, to find the closest one, and many no longer require appointments. I think, frankly, most no longer require appointments. That website's a great place to go, covid19.nj.gov/finder. And through our Grateful for the Shot program, we're also bringing the vaccine directly into communities through the efforts of our faith leaders. And I specifically thank not just them and bless them all, but I want to thank our partners at CVS and Walgreens for their help. Additionally, here's another myth. Please listen to this. Getting vaccinated is free, period, even for those without health insurance coverage. Cost should not be on your list of considerations. No one will ask you for money upon being vaccinated, nor will an insurer ask for a payment. It is all covered. It is free of charge, period. And finally, anyone who lives, works, or studies in New Jersey is eligible to be vaccinated. And by the way, that's regardless of immigration status. No one will ask your status when you go to get vaccinated. This is about ensuring public health and the personal health of everyone in our state. Getting these points across is a big part of the door-to-door outreach program we are undertaking through Operation Jersey Summer to provide accurate information, to help dispel myths, and to build vaccine confidence. So I mentioned that on Monday, our door knockers were in Trenton, Camden, Bayonne, Jersey City, Passaic City. As of today, Dan Bryan, Patterson is on that list. Our teams will continue to knock in those 6 communities, and as of this Friday, they will add Perth Amboy, New Brunswick, Vineland, and Atlantic City. So that'll be a total of 10 communities as of this Friday. Again, the new one is Patterson today, and as of Friday, Perth Amboy, New Brunswick, Vineland, and Atlantic City. Anecdotally, Judy, this is what I'm hearing. 3,000 to 4,000 interactions a day in those 5 communities. That number will go up because we're adding a lot of communities. And by the way, it'll go up because they're going to deepen their reach into the communities where they have already been knocking. For those folks who have not yet been vaccinated, the anecdotal evidence I'm hearing is about half of those conversations are constructive. Okay, great, I didn't know it was free, didn't know this location was near, didn't know my status had nothing to do with it. To me, that's a good sign. And the numbers, again, continue to go up. So it'll be more communities and more doors in the communities in which we are knocking. We know, by the way, the impact trusted community voices make. We want to make sure everyone has correct information and that no one misses their opportunity to be vaccinated. We are all in this fight together. And as we continue to push our vaccination program, we are seeing the results in the decreasing daily caseloads, in the falling patient numbers in our hospitals, because we know of the effectiveness of the vaccines in slowing the spread of COVID-19 and preventing illnesses. So with that, let's look at some more numbers. Overnight, we're reporting 451 additional cases. The rate of transmission is 0.75. The positivity rate for Saturday, Judy, this is the first time we've been below 3% for a weekend in a long time, was 2.79%. As of last night, statewide hospital census, 641, including 560 confirmed, 81 awaiting test results, 137 of whom in ICU, and 94 ventilators were in use. Throughout the day yesterday, 97 live patients walked out, 67, I should have 55, it's not, I think I've got 97, hold on a second, 97. Those numbers are not accurate. 97 were discharged, 67, Judy, I've got 67 walked in, and I'm showing 12 hospital deaths. So we got to correct that slide. And again, those deaths are not confirmed. Those are as reported to us by the hospitals. Having said that, we are, with the heaviest of hearts, reporting an additional 25 confirmed losses of life, blessed souls from our New Jersey community. The number of probable deaths has now also been revised upward by 10. It's now 2,670. The total death toll since last March, 26,000, when you add confirmed and probable, 26,159, literally unfathomable. Let's, if we may, honor three more of those who we have lost. We'll begin today by remembering this guy, David Bohen. David was 74 years old, and you won't be surprised from that setting, that hat, the sunglasses, he called Beach Haven home. He was born and raised on LBI. His father was a Long Beach Township police officer, while his mother founded LBI's first all-women's fishing club, ladies. How cool is that? Following his service in the Air Force as a mechanic, he returned to New Jersey to pursue a bachelor's degree in education at the College of New Jersey, known then as Trenton State College. And then he got a master's in education, Angelica, from Jersey City State College. For 30 years, Dave was a beloved shop teacher at Ocean Township Middle School, a youth soccer coach, and he also ran his own construction company. As one would expect, growing up on LBI instilled in Dave a love of the water. He was a member of the Beach Haven Marlin and Tuna Club and the Little Egg Harbor Yacht Club, but he also enjoyed his travels inland, whether it was a cross-country RV trip or visiting his grandsons in London. Dave now leaves behind his two daughters, Ashley, who also lives on LBI and with whom I had the great honor of speaking on Monday, and his daughter Ricky, who lives in London, and Ricky's husband Nicholas, along with their two grandsons Oscar and Bohen. He's also survived by his sisters Kathy and Judy, among many other family members and dear friends. We thank Dave for his service to our nation and his years in the classroom, and I trust that Dave is somewhere where the waters are calm and the fish are biting. May God bless and watch over him, his memory, and his family. Next, we'll stay along the shore to remember Brick Township's Thomas Kelty, standing alongside his wife Eileen there. Tom was a longtime iron worker, a member of Iron Workers Local number 580 in New York City and number 11 out of Bloomfield. He retired in 1990, but he never slowed down. He just found new ways to stay active in the communities in which he lived. He was a member of St. Dominic's Roman Catholic Church in Brick, a fourth-degree knight with the Knights of Columbus. He served in leadership positions in that organization, including as a district deputy and grand knight in Brooklyn. By the way, that's where he was born and raised, and in West Milford, where he lived until moving to Brick in his retirement. He was also a member of the Point Pleasant Elks Lodge number 1698. And Tom leaves behind that gal, his wife, Eileen, after 73 years of marriage. He is also survived by his three children, son Tom Jr., his wife Doreen and his daughters June and her husband John, his daughter Patricia and her husband Rick. He also leaves behind his 2 grandchildren, Kelly and Rick, and great-granddaughter Mackenzie, and he is survived by his remaining brother and sister, James and Ann. I had an extraordinary call with many Kelties on Monday, his wife and widow Eileen, son Tom, daughter Patty, granddaughter Kelly. We thank Tom for his years helping to literally build our region and for his many years of community service. Eileen said to me on Monday that he loved the show and that my saluting him today would be, for him, one more show. Tom was 93 years old and earned every single blessing that he receives. May God bless over him and watch over him and his incredible family. And finally, today we remember Stephen Soto of Freehold Township. And Steve was just 48 years old. Born and raised in Patterson, at a young age he showed great promise as a pianist and attended the Rosa L. Parks Arts High School. He then went on to earn a degree in psychology at Montclair State University, where he was also a founding brother of that school's chapter of Lambda Theta Phi Latin Fraternity, Inc. Steve was in the midst of a successful career in business and finance and was most recently a financial advisor in Monmouth County. But it is his community service that will contribute mightily to what will be a lasting legacy, coaching his daughter's youth softball team and participating in beach cleanups at the shore. Stephen leaves behind his wife of 20 years, Jessica, along with his 2 daughters, Kendall and Lauren. Kendall is 19, Lauren is 14. You can see them all there. I had the great honor of speaking with Jessica and Kendall on Monday. He's also survived by his parents, Felipe and Norma, along with his sister Denise and his cats, Bubbles and Pharaoh. He also leaves numerous aunts, uncles, nieces, nephews, and other extended family. And of course, he leaves behind countless friends. May God bless Stephen and his family. We thank him for his years working to make the communities in which he lived better. And God bless his wife and daughters and his mom and dad. As we head into Memorial Day weekend, let's keep Dave, Tom, and Steve and their families and all we have lost in our thoughts and prayers. Finally, let's end up on a high note. Let's pull up this guy. This is Hella Sadiba from Rochelle Park. Hella Sadiba. On Sunday, he ran his way into New York City, capping a run that started in Huntington Beach, California. 84 days, 15 states, and more than 3,200 miles prior. Hella is a native of Mali in West Africa, and I believe either a current or former professional soccer player. As I mentioned, he now calls New Jersey home. Joining him for his trek were his girlfriend, Alexa Torres, and his best friend, Garrett Jones, who drove the support vehicles. That's where I would have been, by the way, in the support vehicle. Along the route in which he averaged roughly, you ready for this? 40 miles a day. Dave, you can do that. Hella would sometimes be joined by runners who would hop in to pace alongside him for a few miles. That he would do this shouldn't have been a surprise, as Hella already had been working on a running streak that stretched back every single day to May 15th, 2017. A tremendous accomplishment that shows the enormous spirit and stick-to-itiveness of our state. Hella, to you and your team, congratulations on an extraordinary run. What an inspiration. You have hereby earned a day off. With that, thank you for being with us today. Let me turn to the Acting Commissioner of the Department of Education, Dr. Angelica Allen Mcmillan.
Thank you, Governor Murphy, for the opportunity to join you today. I am excited to highlight this week's significant milestone in the administration's implementation of the Federal American Rescue Plan Act, Elementary and Secondary School Emergency Relief Fund, or ARP-ESSER. Earlier this week, the New Jersey Department of Education published several updates related to ARP-ESSER under the American Rescue Plan Act that President Biden signed in March. New Jersey is slated to receive an allocation of $2.76 billion. ARP-ESSER marks the third installment of ESSER funds, with the first two authorized by the CARES Act and the CARISA Act. ESSER funds are designed to support school districts in preparing for and responding to the impacts of COVID-19 on students, educators, and schools. The first installment of ESSER funds was released in May 2020. School district applications for the second installment were made available in March and are due on June 1st, 2021. Regarding this third installment, on Monday, the New Jersey Department of Education published each district's total ARP-ESSER fund allocation, which must be calculated based on the district's share of funds received under Title I, Part A in the 2020-2021 school year. Under ARP, as was the case under the CARES Act and the CARISA Act, at least 90% of the state's total ARP-ESSER allocation must be subgranted directly to school districts in this manner. In New Jersey, this amounts to approximately $2.49 billion in funds to school districts. The New Jersey Department of Education also released the ARP-ESSER fund application for districts on Monday. Due to how the United States Department of Education structured the release of ARP-ESSER funds to states, at this time the application will provide school districts with access to 2/3 of the total amount of their ESSER fund allocation amount. In order for New Jersey to receive the remaining 1/3 of its ARP-ESSER allocation and to provide districts with access to the remaining 1/3 of their allocations, the New Jersey Department of Education must submit an ARP-ESSER state plan to the United States Department of Education. The state plan details, among other provisions, the New Jersey Department of Education's draft proposal for additional projects or subgrants funded by the over $276 million in state set-aside funds under ARP-ESSER. On Monday, the New Jersey Department of Education released a draft of its ARP-ESSER state plan for public comment. The draft and supporting resources may be found on the New Jersey Department of Education's ARP-ESSER website. You will see that our proposal would leverage these federal funds to meaningfully boost school district capacity to develop and implement high-quality interventions that address the academic, social, emotional, and mental health needs of students and educators. We address federal requirements to invest in the academic impact of lost instructional time, summer activities, and activities taking place beyond the traditional school day, with grants for comprehensive professional learning, for academic and school climate interventions, and grants to build on the framework established under ESSER II to accelerate learning. We also propose funding several activities to provide districts with the staff and external supports needed to build expertise and capacity to implement learning acceleration and small group and targeted interventions for students. We will be accepting comment until Thursday, June 3rd, 2021. The Department of Education must submit our state plan to the U.S. Department of Education by June 7th, 2021. Finally, the New Jersey Department of Education released a template for school districts to use to satisfy federal ARP requirements that each school district develop a plan for the safe return to in-person instruction and continuity of services. That plan must be submitted to the New Jersey Department of Education and posted on each school district's website by June 24th, 2021. In accordance with deadlines set forth by ARP, the template, plan, and additional information will also be available on our website. I am thrilled to share these updates with my fellow educators. ARP-ESSER funds will be available to school districts through September 30th, 2024. These funds represent a significant investment in the capacity of our state and our school districts to respond to the impacts of COVID-19 over the next 3 years. I continue to ask myself and my staff, what supports and resources must the New Jersey Department of Education put in place now with this significant funding to be able to look back in October 2024 and be proud of the work we did to meaningfully empower students, educators, and schools to address the academic, social, emotional, and mental health impacts of COVID-19. The ARP-ESSER State Plan, released this week, represents our current best thinking on this important question. I encourage educators, parents, caregivers, and members of the public to visit the New Jersey Department of Education's website for additional information. Thank you.
Angelica, thank you. And deep appreciation for your leadership. And these are not normal times. So thank you for all. And thank you for being here today. With that, please help me welcome the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persicelli.
Thank you, Governor. Good afternoon. We continue our work to bring vaccinations into communities, making it easier for residents to receive a vaccine dose. Part of that effort is the state's Grateful for the Shot program. In partnership with the Governor's Office, the First Lady's Office, the New Jersey Pandemic Relief Fund, the Department of Health, and faith leaders, Grateful for the Shot brings vaccinations to congregations in targeted communities. Each event has a block party type of feel in a trusted and community atmosphere with a mix of food, music, and prizes in order to break down barriers to accessing the vaccine for individuals and families. This program is part of Operation Jersey Summer, the statewide effort aimed at vaccinating all eligible individuals who live, work, or study in New Jersey. Over the last weekend, these events were held in East Orange, Passaic, Bayonne, Newark, Bloomfield, Elizabeth, Hillside, Bound Brook, Westville, Lakewood, Englewood, Camden, Vineland, and Willingboro. More than 760 residents were vaccinated at these events. This effort will continue during the Memorial Day weekend with events held at houses of worship in Orange, Glen Rock, Newark, Pleasantville, Atlantic City, and Hightstown. Also, upcoming this weekend, the New York Red Bulls, in collaboration with the state and Hackensack Meridian Health, will hold a vaccination clinic at their stadium in Harrison before the match on Saturday. This event will be open to both ticket holders and the public. Our COVID-19 Community Corps will be canvassing the neighborhood and will be on site to answer any questions. As we celebrate Memorial Day weekend, we know many individuals are planning to travel to the Jersey Shore, and this is another place vaccine will be available. The Visiting Nurse Association of Central Jersey Community Health Center is partnering with Monmouth County, our Department of Health, and Walmart to provide COVID-19 vaccinations to those visiting the shore this weekend at the Grand Arcade in Asbury Park, the Sandy Hook Gateway National Recreation Area, and the Long Branch Boardwalk Gazebo. And the Governor and I will join Congressman Frank Pallone and the VNA at the Asbury Park Boardwalk this Friday to highlight this vaccination partnership. These pop-up clinics are making progress in vaccinating residents where they live, work, and play. The state's larger vaccination sites also continue providing vaccines through the hub and spoke model. The 6 mega sites, the FEMA site in Newark, and the satellite vaccination pop-ups in Hudson, Passaic, Union, Bergen, and Atlantic counties have administered more than 2.2 million doses. On to my daily report. As the Governor shared, our hospitals are reporting 641 hospitalizations. Thankfully, this number continues to decline. Fortunately, there are no new reports of multisystem inflammatory syndrome in children. There are 126 cumulative cases in the state. None of these children are hospitalized at this point. At the state veterans' homes, no new cases among their residents, and at the state psychiatric hospitals, no new cases among their patients. The percent positivity as of May 22nd in New Jersey was 2.79. The northern part of the state, 2.41%, central, 3.37%, and the southern part of the state, 2.88%. So that concludes my daily report. Please continue to stay safe, and let's get vaccinated.
Judy, two things. I love the variety of programs that you've got going that are bringing the vaccines to the people. So if it's Memorial Day weekend on the Jersey Shore, in this case in Monmouth County, my home county, we know where the people are going to be. And secondly, just to hit again, you and I both made this point, this positivity rate to be under 3% for a weekend, given the past basically, I guess at this point, 9 months plus or minus that we've gone through, that was never under 3% is a nice number to see. Thank you as always. Pat, great to have you. You need to work on the weather for the weekend. That's one favor to ask you. On a far more serious note, another loss of life since we were here on Monday in the Fairfield tragedy and shootings on Saturday night. A young woman of the age of 19, to the best of my knowledge. God rest her soul. And if that weren't enough, it's almost a daily drumbeat. There's now a big mass shooting that is taking place this morning in California. So in that respect, with a heavy heart, also would love to get a sense of, this is a particular special week and month, and I know you were going to address that as well. Great to have you.
Thank you, Governor. Good afternoon. With regard to this week, as far as it is National Boating Safety Week, and we know that with the warmer weather and certainly with Memorial Day weekend, the number of recreational boaters, kayakers, paddleboarders, canoers, 1,700 lakes in our state, 130 miles of coast, our bays and rivers. We just want people to remember to be safe out there so we can prevent anybody from getting injured or harmed. Our Marine Services Bureau this summer was kind of focusing on personal flotation devices, but they have a phenomenal comprehensive one-page checklist on njsp.org/marine services. I would recommend those going out onto our waterways to check that out. It's just a quick reminder, everything from fire extinguishers to air horns to life jackets, and just remind any child under 12 must wear a life jacket while out there, and certainly about not consuming alcohol while boating so we can avoid those tragedies. And yes, we did lose a third victim to the Fairfield Township, Cumberland County shooting, and that investigation remains ongoing, Governor, and will continue to unfold. The partners and troopers in that investigation are working 24/7, not only from the evidence front, but certainly on to bring those responsible to justice. Thank you, Governor.
No EO violations?
Oh, there was no EO violations.
Okay.
Correct as well.
There are about to be no EOs, so that part of our program will have to fill in with something else. I just want to confirm, we rarely, I don't know that this has happened even once before, but we rarely have different numbers up here than the slideshow. I want to reiterate that the numbers I spoke to are the accurate ones. So again, our hospitals reporting yesterday, 67 people came in with COVID, 97 live patients were discharged, and the hospitals reported 12 unconfirmed passing of 12 lives, tragically. We'll start over here with, before we do, we will be virtual tomorrow. Judy's already alluded to this. We're going to be on the road on Friday, maybe more than one place, but we'll be out there on Friday. And all kidding aside, the weather looks like a little bit cooler and a little bit wetter than we would like. Today and tomorrow look like they're beautiful, but that won't hold us back. So I'm going to have the honor of participating over the weekend at the Veterans Memorial Cemetery in Burlington County. We got a couple of parades on tap, extraordinary food extravaganza coming up to Hudson County. Judy mentioned grateful for the shot in Harrison on Saturday. We may be passing through there on Sunday. A lot of activity, even if the weather isn't hospitable. We will not have a presser on Monday, not surprisingly, because it is Memorial Day weekend. And let's keep all of our veterans and members of active service in our prayers, particularly those who have been impacted, suffered, or lost lives due to this pandemic. But unless you hear otherwise, we'll be back at it next Wednesday, so a week from today, and we'll give you more details on what that looks like as we get closer. So thank you for that. With that, Alex, good to have you back here.
Yeah, thank you, Governor. Alejandro Rubian, NJ News. Governor Murphy, right now in the state of Mississippi, a black person can carry a gun for self-defense without asking permission or showing justifiable need, as long as they are not a prohibited person. That same black person has no hope for qualifying for a permit in New Jersey, laws that you've stated you are very proud of. Why do black people have more rights in Mississippi than they do in New Jersey?
Is that it?
Yes, sir.
Alex, you and I have had this conversation before. This is not the first time. I'm not sure you referenced Mississippi in the first time, but you asked this question. We fundamentally believe that fewer guns in our state means a safer state. It has nothing to do with what color your skin, who you are as an individual, what ethnicity. Fewer guns is a safer state. And we believe that we're not a state that supports the lowest common denominator of anybody can carry. Texas is moving toward this, if I understood this, not requiring licenses, concealed carry, open carry. We just think that leads to a more dangerous state. It has nothing whatsoever to do with anyone's race. I apologize, that's where we are and that's where we're going to stay. Thank you. Hey, Matt.
Good afternoon, Governor. Is the state considering winding down the use of the mega sites? And given the lower number of daily cases, are health officials better able to try to track down where and how those folks are getting infected to see if some behavior is more dangerous than others or any trends? And what do you say to the people, including the superintendent and the Board of Education in Ocean County, who put out some strong statements and pushback after you said that children will possibly have to wear masks in September?
Superintendent from where, sorry?
Ocean.
Ocean, okay.
And also there's been a lot of pushback against parents. I'm getting incoming of folks saying that why does my child need to wear a mask at a summer camp? These folks are at especially low risk. So how do you respond to them? And Nikita would like to know whether you have any additional thoughts on last night's GOP debate beyond what you said in your statement last night.
Nothing on the debate. I can take that off the table. I'm not paying, honestly, if you follow me around, you note that I'm not paying any attention to politics and certainly not what they're going through. We're still focused on what we're doing here today, but nothing more to add there. I'll go back to the top. The mega sites, my guess is the mega sites, pardon me, at some point will wind down. We're not there yet. And Judy mentioned this, they are the hub of the hub and spoke strategy. So even if you were to walk into a mega site today and not see a lot of people, and I suspect that's probably true at all 6 of our mega sites, what you would not see is the support they're providing into community efforts. So they continue to be, unless Judy corrects the record here, they continue to be that hub. At some point, they will wind down. I did ask, I mentioned, I was going to say this to you privately, Judy and Eddie. I asked a senior person, I'll leave nameless, but someone I respect in the healthcare community. I said, what's your guess on frequency of needing the shot? He leans toward, and the evidence is still to be determined, he's leaning toward, and he thinks others are too, that this is going to be more like an annual flu shot event. We're not making news here because this was one guy's opinion. But the reason I say that is, we've said this before, we want to keep either literally or figuratively the infrastructure that we have so painstakingly built to get us to where we are today. Whether that'll be mega sites or not, too early to tell, and it's also too early to tell whether or not that observation by that gentleman is on or not. I'm going to have Eddie and Judy answer the question of where we think folks are getting infected, but I do want to pose the question. I know it's a softball to try to get more people vaccinated. I'd be surprised, and I don't know if we've got data, that people who are getting hospitalized or, God forbid, in ICU or sadly dying have been vaccinated. My strong suspicion is they have not, and I don't know that we have that data to share with you. Well, that's a question I'll let them. I was going to ask the same question. I'd like to address masks if I could, and then ask Judy and Eddie to address all of the above. I didn't see the letter yet from the superintendent in Ocean County, This is, it's May 26th. We're trying to predict what school looks like on September 5th. That's basically 3.5 months from now. I've been asked at this moment in time, what's my guess? My guess is we're likely to be masked for the simple reason that we only a couple of weeks ago have been able to get 12 to 15-year-olds vaccinated. That's early stages, really good, but it's early stages. We've been at 16 and up since December, which is 6 months into it. There's no vaccine yet that's approved for under the age of 12. Again, a good discussion last night with the same gentleman, and he has the same sense that we have, that the trials out there look like they're going well, but we don't have visibility into them. And do we expect, I think we do expect that there'll be vaccines for younger folks, but they're not there yet. Do I anticipate that we will get to a day at some point where we're not wearing masks? Yes. Do I want that to happen? Absolutely. Safely and responsibly. I can't say when. Someone asked me this morning, I think another good question inside of that is, do you think you could lift them in high schools before younger ages, because the high school kids by definition will have been vaccinated or will have had more time on the clock? I'll bet you whenever it is, my guess is the answer to that's probably yes, I would guess. And I think the summer camp answer is the same, Matt, that we're not there yet on being able to, we know, thank God, that we've lost very few precious young lives. But we also know that that doesn't mean that the young folks have not been able to transmit this, either get it or transmit it. And so these are not forever and always. We will get to the place that parents want to get to, that we all want to get to. We're just not there yet. So, Judy, Eddie, any sense of where folks are getting infected? Any sense as to whether or not we'll have data at some point? Eddie, you'll be gone, but when will we have data on somebody goes into a hospital, yay or nay, were they vaccinated? And any other color you want to add on masking, et cetera, particularly in school?
Well, let me deal with the with the issue of those who are vaccinated. The CDC published this week in the MMWR. It came out, today's the 26th, right? So yesterday, date on what we call breakthrough disease, and we've talked about that at previous press conferences. And they're reporting between 1st of January and the end of April, a little over 10,000 cases of individuals who were documented to be reinfected. This is across most of the country. And only 10% of those were hospitalized. There were a number who were asymptomatic. They were discovered because they were tested and found to be infected, but had been previously vaccinated. And during that time period, there were over 100 million people who were vaccinated. So it gives you some sense that despite over 100 million people being vaccinated, only about 10,000 of them were actually documented to be infected after full vaccination. And these were fully vaccinated people, and only 10% of those were hospitalized. 2% died, but the average age was about 80, so they were high-risk people. So I think that gives you a sense that not very many people get sick, not many people get sick enough to be hospitalized, and very few die.
Yep.
Yeah. As far as the outdoor masking is concerned, well, I'm going to talk about the camp masking. That's a difficult issue, and I think it's more difficult in those camps where most of them are teenagers or above the age of 12 because they can get vaccinated. I do know that the CDC is working on revising some of its camp guidance based on the fact that 2 weeks ago or 2 or 3 weeks ago now they issued the new mask guidance. And they admitted that at that time they had a lot of policies that needed to be revised based on that basic revision of policy. So we may see some new guidance for camps from the federal level, and I would say that might impact on what we say for camps in New Jersey.
That to me is the one outlier that I think, again, we're following the CDC on this stuff, but that to me, the outdoor piece of this is the outlier. Thank you, Eddie.
Yeah.
We're going to miss you.
And you said I'm going to be gone, but I hope not forgotten.
You won't be forgotten. And I have your phone number, so thank you. Angelica, I've said this in your absence, and you're here, and you're the commissioner, but I've said we put guidance out last June, a thick piece of guidance on what we expected school to look like in September. I wasn't promising a committee you to a June timing, but that we also updated that over the course of the summer because this is a pandemic, and it dictates the terms. Are you generally comfortable with that as a time frame? So want to make sure I'm not putting words in your mouth, so thank you for that. Thank you. Alex.
Good afternoon.
Good afternoon.
Just to follow up with Dr. Bresnitz, can you talk a little bit more about the data and science that support masking kids outdoors at summer camps? It almost sounds like you don't agree with the position of keeping kids masked at summer camps. Can you talk about that a little bit more? For the commissioner, should adults who have had COVID-19 and have the antibodies still get vaccinated? If so, why? If not, why not? For Dr. Mcmillan, we talk about the possibility or the likelihood that students will be vaccinated in classrooms in September. Students will be masked in classrooms in September. How long do you think that will continue? Could it be June of 2022 and we're still talking about kids, students being masked inside schools? For Colonel Callahan, will you be enforcing EO violations at summer camps? Is Trooper Johnson going to tell little Timmy to put his mask back on by the pool or not? And lastly, for you, Governor, these mandates that
I thought you were going to skip me today.
Never. Save the best for last. These mandates for outdoors at camps, indoors at schools, for you, is this a carrot and stick approach to try and convince more parents to get their 12 to 15-year-olds vaccinated?
All good questions. I'll start and then let others. Eddie, you speak for yourself. I didn't hear you questioning the science as much as we know that outdoors this virus is a lot less lethal. Summer camp, by definition, it's warmer weather, so you can be outdoors. But we have to take into account the fact that kids have not been able to get vaccinated, so you've got that reality as well. Judy or Eddie, you should address, I won't even try to answer this, but I'm pretty sure the answer is yes. If you've had COVID, you should still get vaccinated. We had a family member, that family member had COVID, is vaccinated, and came through with flying colors. Angelica, you should weigh in. We don't know the answer to that question. We just don't know, but except that it's not a forever and always, and you're welcome to add any more color on that. Pat, I assume you'll go gently on these little Johnny or Sally at the summer camp EO violations. But all kidding aside, it's the operator, not the kid. It's the operator, a long-term care, whatever it might be. It's the operator that, and I can't remember help me out, Matt. Matt Stinney's got the mic. The last one for me, outdoor and at camps or indoor at schools.
In general.
Oh, as a incentive to get vaccinated. I think it might be, but that's not the reason for me. I think Alex, in fairness, I think it might be. It might have that salutary effect. And if it does, that's a good thing. But it's basically following the guidance from the health professionals, from the CDC. What's the safest, most responsible way we can get back full on in school in the fall in particular. So it's far more about safety and responsibility. Any observations about any other, we'll go quickly here just as a buzz around. Outdoors CDC guidance, should you still get vaccinated, Judy? If you've got COVID, the answer is yes, right?
Yeah, if that hasn't changed. If you've had COVID-19, you should still get vaccinated. They say 90 days after you're symptom-free.
Eddie, anything you want to add to any of the above?
You know, the issue of outdoors activity for children in camp setting is not an easy one to ask, and I think that's why the CDC is looking carefully at its policy. For younger kids, they're not vaccinated, and there's mixing of those kids, and they're coming from different areas, and so there may be some exposure. They can bring it home as well. Hopefully the counselors and the staff will all be vaccinated, so the risk of transmission from the older to the younger will be minimized, if not zero, because the vaccines are so effective. I think we'll see what the CDC has to say, and then we'll think about it ourselves and make our own policy based on that.
We had a good exchange earlier, several of us. Masking is not like plexiglass, ventilation systems, even 6-foot social distancing. You can turn, if the science suggests, you can turn your mask guidance on a dime because it's easy, right? You just don't wear this that next day. So stay tuned. Anything to add in terms of when? The answer is we don't know this, right? We don't know. Pat, are you going to be lighting up the summer camps?
To your point, the operator.
Okay. Thank you for that. Do you have any? You do. give me 1 sec here.
As the state drops more indoor restrictions this week and next, we're still seeing low vaccination rates in some communities, particularly in cities. Are you concerned that towns with just 30 or 40% of adults vaccinated will seek spikes in COVID? And would you consider regional restrictions to prevent that? Also, are you still confident you will reach your goal of 4.7 million vaccinated adults on schedule? And will that number change as you account for children getting vaccinated? From Leah, Michigan, sort of following up on what Matt had asked, regarding the masks in school, what is your response to the GOP bill to allow masks in school and give that decision to the parents? The Department of Labor did not report new unemployment claims last week. Do we know why? Are their numbers accurate? And if so, is that evidence that the 300 federal benefit enhancement is keeping people out of the workforce? And I might have just gotten, okay, that's.
Is that it? Okay. I'm going to take a shot at this, and you all should come in behind me. Number one, the reason why we're knocking on doors and added Vineland, Perth Amboy, New Brunswick, and I forgot the fourth that we added, plus we added Patterson today, is for that very reason. We are focused on, and this is not vilifying these communities. It's not, trying to embarrass anybody. The fact of the matter is we have got to punch up at a higher weight in terms of our vaccine penetration, and that's why the Grateful for the Shot program that Judy talked about, the door-to-door, all the various programs. Gratified, by the way, to hear that over 13,000 people have signed up, Dan, for dinner with Tammy and me. So it's going to be a crowded dinner. So the regional stuff, we've talked about this a lot. It does work. Obviously, schools are district, as Angelica knows more than any of us. Judy looks at the Cali scores by region and sub-regions of the state. But you get into very dangerous unintended consequences if you try to localize that into restaurants, bars. You just get people going from one part of the state to another. We had that concern, frankly, between the state and our neighboring states. We certainly don't want to have that concern inside the states. Will we get to 4.7 million on schedule? I believe we will, but it will not be without a lot of effort. So we need folks to stay at it. We had 20-odd thousand first shots yesterday. That's a good thing. That included some amount of the kids, so we have to factor that in as well. The CDC, which has access to more streams of data than we do in terms of other federal programs and folks who have a Jersey affiliation, suggests we'll get there, but we will not get there without a lot of trying. I'm not familiar with the bill. With all due respect, we're following science, health experts on things like masking and frankly everything else in this pandemic. So any bill that is counter to that is not something as a conceptual matter that I'm going to support. And again, I want to repeat this. we don't want to have kids or everybody in a school setting with masks on any longer than we have to. But if we think we have to do it to safely and responsibly have them back to school, we will do it. And again, it is not forever and for always. I have no insight on your question on Department of Labor. Dan, will you help me follow up on that, if that's okay with you? Thank you very much. Dave, good afternoon.
Hi, Governor. Can you explain why you're letting employers lift the mask mandates for vaccinated workers? Is this a clarification, or is this an actual real change? Because there was some speculation that this was just a cloudy issue that kind of got lost in the shuffle. And also, why are employers being told that they should check the vaccination status of workers, but not retail employers in stores, restaurant owners or managers, gym managers, guys who run concert venues, etc.? Let's see here. There has been, has there been discussion, any more discussion at all, about possibly offering some sort of a cash prize to entice people to get a vaccine? I know we talked about this last week. Maryland is now giving people who have been vaccinated a chance to win $40,000 in prize money every day for a month. And in New York, Cuomo is giving, we just learned, vaccinated kids ages 12 to 17 a chance to win New York public universities and colleges scholarships. Apparently they're going to raffle off 50 complete scholarships to cover 4 years tuition, room and board, etc. This would obviously be an incentive to try to get more younger people vaccinated. And finally, even with vaccine numbers rising in New Jersey, now that we're about to lift the masking and social distancing mandates, are we expecting any bump up in infections and hospitalizations? We have a lot of people vaccinated, but we actually have a lot of people that are still not vaccinated. Especially with the big holiday weekend fast approaching, would we expect to see an increase in infections and hospitalizations in the next couple of weeks? Thank you.
Thank you, Dave. I want to go back to, I didn't understand the entirety or didn't hear the entirety of the Department of Labor question, but I think one of the questions, Rob Angelo is listening, is whether or not the $300, did you also ask whether the $300 premium was disincenting people from the workforce? Rob, I'll quote Rob, there is zero evidence, study after study, report after report, that the enhanced benefits are keeping people out of the workforce. I'm not sure I'd be that categorical, but I have said that I believe, even if it's possible, it is somewhat of a contributor. And by the way, Rob's a professional in this and I'm not. There are a whole host of other factors. Lack of childcare or access to childcare, schools not being fully back in person, people being flat out concerned, afraid to get back into the mix. And I think what you would have seen in the study that's most compelling for me is the $300 is more significant in a lower earning, on average earning state. And if you look at those states and the employment trends in those states, in other words, the $300 is a higher percentage of what they otherwise would have earned. There's no evidence that suggests that's the case in those states. So I'll leave it at that. Dave, we just heard, I think it's I call it a significant tweak, but it's an understandable one, that in the sort of, remember, OSHA has still not put out workplace guidance. And in the absence of that step last year, we put out our own guidance. And we felt we needed to, and we heard this quite constructively from a lot of businesses that said, listen, you've got this very strict mandate. Is there do we have the ability to have a different standard for somebody who's not vaccinated? And I think that's a very reasonable ask, and that's where we've gone. It's a week from Friday. And the other point, which you did not ask about, but to reiterate, we had one of our executive orders. I'm summarizing. If you can work from home, figure it out and have your people work from home. We're lifting that and saying, listen, it's okay based on the evidence we've got. Paramount, how would you distinguish between an employer who, I'm making this up for a second, a law firm or a factory versus Rite Aid?
Yeah, so our point is that employers who have employees coming into the office, that's a known population, so they can verify whether those employees are vaccinated or unvaccinated fairly easily. If you're a supermarket, for instance, you don't know which members of the public are coming into your store, so it's much harder to verify vaccination status. In addition, retailers operate across multiple jurisdictions, across multiple states, so we wanted to give them more flexibility regarding mask wearing and social distancing policies because we know a lot of them operate nationally.
We continue to be not opposed, Dave, to other incentives. We've put a lot of these programs out ourselves, and we'll continue to look at whether or not we think there are others out there that make sense. $40,000 a day. It sounds like you were considering relocating to Maryland within the month, but those are all valuable programs. We're seeing a lot of take up on. I was kidding, but not only half kidding on the dinner with us, but the Grateful for the Shot, the pop-up sites, the shot in the beer, the uncork the vaccination, the faith stuff. A lot of this, the door knocking is the least sexy, but it's sort of a grind out execution part of this, and I think we're doing that as well as any state in America. And listen, I think we've said this when we have opened up over the past 9, 10 months at this point, and we owe to say it again to your question. I think you both asked a similar good question. Could we be exposing ourselves to an increase in cases? I think the answer is we go into this anticipating that we're taking manageable risk, that the risk is there, but that it's manageable. It's within our ability to safely and responsibly take those steps, including especially to never go near overrunning our hospitals. Would you all agree with that assessment? Eddie?
Yeah, two comments. Just first on the OSHA. I know that OSHA is working on revising some guidance for employers. It came up on a call that I was on last week with the CDC, and they mentioned that. This was based on the CDC's changed recommendations.
Yep.
Anything's possible with COVID-19 at this point. We know that. But if you look at the graphs that the governor showed earlier with the decline, and if you compare it to the left side of the graph, you see our numbers are approaching where we were like last September. I think that's as far left as we went, and so at the low of the summer. And I think that's where we're heading. Again, we have more outdoor activities now. We've only really been outdoor for about a month, maybe. And there's going to be more outdoors, less transmission outdoors. CDC published in the MMWR some modeling which showed that nationally, not focused on New Jersey, where people can more vaccinations, people adhering to MPI where appropriate, non-pharmaceutical interventions. And, I think that all the signs are pointing that we're not going to expect to see those increases in hospitalizations like we saw last April or even just as recently as 3 or 4 months ago, just because of outdoors, vaccinations, and so on. Those vaccines, everything has shown that those vaccines in post-authorization studies are incredibly effective. The Pfizer vaccine, the mRNA vaccine, and soon we'll see some post-authorization data on the J&J vaccine as well. And plus, the 12 to 17-year-olds are going to be vaccinated more as well. So lots of reasons not to expect it.
That vaccine's efficacious, including against variants, and that's an important element as well. Thank you for that. Dustin, last but not least, good afternoon.
Thank you. On that shooting in Cumberland County, are there any measures that you've proposed or are pending in the legislature that you think might have prevented that from happening? Has there been any agreement with legislative leaders since that shooting to send you the package of gun bills that you want passed? The current eviction and foreclosure moratorium ends in mid-August. Do you want to extend it further? And how are discussions with the legislature going in regards to those protections and expanding rental relief? And then on unemployment, the Labor Department has explained to us that when claims are escalated, some are fixed in days, others in weeks, and the vast majority within 8 weeks. But we've heard from plenty of people, and only for the sake of transparency, I can attest to this, that claims have still not been processed in 6 months to a year, even though they've been escalated multiple times. Can you explain the reason for these delays, how much longer people will have to wait, and when will you open Labor Department offices so claimants can get in front of a person for their issues? Thank you.
I missed one thing in the middle before Matt moves away. The moratorium on what was it? Sorry?
On eviction and foreclosure, that ends in mid-August. Do you plan to extend it further? Okay. How are discussions with the legislature going in regards to those protections and expanding rental relief?
Yeah. Let me, if I may, I may want to come back to Paramount and of the legislation that we've suggested in 3.0. Any items you'd highlight that would have? I mean, we've got a lot of money into, and I don't have. This is not specific to Fairfield, Dustin, because I don't know that this per se would have made a difference. But part of the proposals we put forward is a significant amount of money of preemptive intervention. The Newark Street Gang model to promote that and to get it proliferated into more parts of the state. I can't say that per se that would have factored here, but that's one that would come to mind. Paramount, anything else on your list?
I would just say that the investigation's ongoing, and we're still trying to figure out what guns were used in the shooting and how the individuals who used those guns obtained them. So until we have that information, it's really hard to say whether the measures that we're proposing could have prevented something like this.
I'm going to keep my answer at a non-Fairfield level as well, but Pat, am I right? One of the bills would basically stamp ammunition. You'd have a much better ability to keep track of that. You'd digitize that whole purchase and sale process. There are age restrictions on when you could purchase a gun. Again, I think Paramount makes a good point. None of these are specific to Fairfield, and we're not going to talk about that, but those, to me at least, are all smart steps to make. But particularly if you find, which invariably is the case, that there are guns that came in illegally from out of state, we need federal legislation.
I would just add, beyond the legislation, Governor, is just look at what we just did in Trenton with the Real-Time Crime Center.
Yeah.
And that funding that your office facilitated, that's already solved multiple homicides in the last few weeks with the intention of getting not only crime guns, but violent recidivist offenders off the streets. And that's already, we're already seeing the effectiveness of that.
Nothing new on the package. I've spoken to the Fairfield tragedy or about it with the Senate President and with a number of other legislators. No updated news on where it stands, but it's something obviously we care deeply about. No update on the moratorium, unless Paramount corrects the record. My guess is as we get closer to these dates, we will. And remember that we also have at the parallel basis, and I think this addresses your rental relief question as well, we have the exercise that we're going through with the legislature, not just in our own teams, but with the legislature, and that process, I think, is going quite well on how do we deploy the American Relief Plan monies. I'm going to ask, if I can, again, Dustin, you've heard the answer before. I don't have a crisper answer for you in terms of the claims that take the longest tend to have the most amount of uniqueness associated, the most amount of, as they used to say, hair on them. I would love it if I could ask our commissioner and the team if you guys could help me connect to get back to, it sounds like Dustin's got a specific sense of this, and I don't want to overstate or understate this question of uniqueness. I know our folks are doing everything they can to get these processed as fast as they can and as soon as they can. And your last question, which is clearly related, when do I have a date yet for when the Department of Labor offices are open? I do not, but those are conversations, as you can imagine, that are picking up steam as we have taken the steps that we've taken, and most importantly, as the viral spread and case numbers have continued to drop. But again, could you guys help me out, follow up on the specifics? So with that, I'm going to mask up. Single mask, Judy. I want to thank Angelica for coming and for your leadership, particularly under extraordinarily challenging circumstances. Pat, as always. Dan, Paramount, I didn't give you a shout out earlier. Jared is watching us virtually. Judy, as always, and Eddie, we will miss you. And on behalf of all of us, we thank you. You've come out of the bullpen on almost no notice, and you've made an enormous difference in our efforts to fight this pandemic and this virus. I dare say you have saved lives without question, and we will be forever indebted to you. So bless you and thank you.
Well, thank you, Governor, and thank you to both of you and Judy for inviting me back to be part of the response team. It's been a really good experience for me. It's been a very difficult time, and appreciate the leadership from everybody here at this table. And you've made some difficult decisions. You've used what I call the precautionary principle, which is making tough decisions and with uncertainty. And the science of COVID-19 is evolving. Every day it evolves, and leadership has to make decisions without all the information available. And it's all been informed by the principle of protecting the public as best as you can with lots of uncertainty. And I think we've, all the metrics have gone in the right direction. That's why I'm moving on.
You're moving on.
So thank you again.
On to other challenges. Thank you for that, and thank you for everything. Folks, we wish you a fantastic Memorial Day weekend. Please be safe. We are virtually wide open as of either between this Friday or a week from Friday. Please take those openings responsibly as best you can. Enjoy yourself, be safe, and thank you for everything by the millions that you have done. God bless.